Control and mental health awareness are two issues brought to the forefront in the wake of the Connecticut school tragedy. And as RTV6's Renee Jameson reports, mental health experts say more needs to be done to raise awareness. Renee?
Well, that's right, Erica. Education in a community, state, and nationwide effort to help remove the stigma of mental illness.
At this point, we do not know the motivation behind this tragic and senseless act, but talk of the shooter's possible mental state has stirred a greater discussion about mental illness and how to improve care and treatment.
The thing that we can do most within our communities is just to talk about mental illness and what it is, and to educate those who may not have that knowledge about mental illness and warning signs and things to look for.
Acacia Tolbert Banks is the Director of Education for Mental Health America of Greater Indianapolis. They offer crisis and suicide intervention services as well as educational outreach programs. They're dedicated to removing the stigma of mental illness.
How do you bring about change to where people will talk about this?
Sure. I think just making it comfortable. You know, the more that our agency puts out, I think people are more receptive because they begin to know us and they become comfortable asking the hard questions.
Mental health experts tell me when it comes to improving mental health awareness, that means education and programs. Unfortunately, they say in the last few years, there have been way too many legislative cuts.
Well, I think you touch on something that's very important. We don't really get much support in doing prevention work like a lot of things in the medical field.
Jim Bush, a clinical psychologist at Midtown Wishart Health, says in order to help more people lead mentally healthier lives, there needs to be ongoing funding, not just year to year.
I think that there is some education going on, but I think there's a lot more that would be useful.
And Dr. Bush tells me IMPD has a crisis intervention team. Officers are trained to act as liaisons to the mental health system, essentially helping to get treatment for those who need it. Renee Jameson, RTV6.